Hi there, everyone. If you are shopping for a marketplace plan in 2026, there is a lot at stake here, from rising premium costs, expiration of premium tax credits, increasing out-of-pocket maximums, and more. The decisions that you make will have an impact not only on your wallet, but on your health for at least the current year. So in today's video, what we're going to talk about is really how to pick the best possible marketplace plan for your needs. We'll cover all of the basics as well as some of the things that you may not have known about, so make sure to stay tuned. So first and foremost, why does 2026 feel so different? Well, here are some of the biggest changes. According to Kaiser Family Foundation, insurers are requesting a median proposed premium of about 18% for ACA marketplace plans in 2026. Also, the maximum out-of-pocket limit for individual plans next year can't exceed $10,600 for individuals and $21,200 for families. But one of the biggest shifts are the enhanced premium tax credits that many enrollees have been counting on. Those are set to expire at the end of 2025 unless Congress acts. Because of this, many people could see premium increases of up to 75%. So it really is more important than ever before that you are smart when choosing your healthcare plan. So let's talk about some of those out-of-pocket costs. Because when you're comparing plans on Healthcare.gov, you shouldn't just be looking at the monthly premiums. But as a refresher, the monthly premium is the amount that you pay on a monthly basis to keep your insurance active. At that point, you'll need to meet your deductible. This is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share. Now remember that there are many services that are covered even prior to meeting your deductible. However, once you've met it and you're responsible for that co-share, it would either be a co-pay, which is a fixed amount, or a co-insurance, which is a variable amount. Co-pays are much easier to understand and often much less expensive. A copay could be something like $25 to see a specialist, $50 for the urgent care, and $250 for the emergency room. Coinsurance is something like 20% or 40%, but 20% of what? 20% of $1,000? 40% of $2,000? You can see how these costs really stack up. And then as you continue to spend, you may or may not reach your out-of-pocket maximum. That is the maximum that you have to pay for covered in-network services that year. If you do in fact reach that out-of-pocket maximum, then your insurance carrier would take on the bills for the remainder of the calendar year for those covered in-network services. However, if it is something out of network, or if it's a service that's not covered, you would still be on the hook financially. So here are some questions that you need to ask yourself. Now, if you're someone who does visit the doctor more frequently or has more extensive medical needs, perhaps because of a chronic condition or prescription needs, then you may want to look into a plan that has a higher monthly premium. I know. Wait, let's discuss a little further. Generally speaking, plans that have higher monthly premiums tend to have lower deductibles, or lower co-insurance and co-pays, or lower out-of-pocket maximums. That means that when you actually utilize your health insurance, you'll be paying less. And as someone with more extensive medical needs, it may make more sense to pay more on a monthly basis for your premiums than when you actually utilize your insurance. Now let's switch gears. Are you someone who prioritizes low monthly costs or predictable care costs? Are you in relatively good health and just need something to cover the basics? If that's the case, opt for a plan with a lower monthly premium. As I said, generally speaking, it will have a higher deductible, higher co-pays or co-insurance, or higher out-of-pocket maximum. But if you're someone that doesn't utilize your insurance as frequently, this will probably end up working in your favor. Now, when we're looking at those metal tiers, you might be looking at a bronze or a silver plan, as opposed to someone with more extensive medical needs who might need a gold or platinum plan. More on that in just a moment. Additionally, we need to talk about networks when it comes to marketplace plans. Now, there are three basic types of plans: HMOs, PPOs, and EPOs. HMOs traditionally will offer you the least flexibility with the lowest monthly premiums. On the other end of the spectrum would be PPOs with the most flexibility but usually the highest monthly premiums. And EPOs are somewhere in between. So with an HMO, you will need a PCP, which is a primary care physician. If you want to see a specialist, you will need a referral from that PCP to go see the specialist. And you can only operate in-network except in the case of a true medical emergency. If you choose to go out of your network, then you have to pay the full price. With a PPO, there are no PCP requirements, you don't need referrals, and you can go in and out of network, although out of network will be more expensive. And as I said, EPOs are somewhere in between. So, if you are someone who needs that flexibility, then a PPO may be right for you, even if the monthly premiums are a little bit higher. On the other side, if you are someone who can operate within network, perhaps you have more time, you're able to get those referrals to see a specialist, then you can save money with an HMO. But don't just go for an HMO because it's cheaper. If you need to see a doctor who's out of network, that HMO will end up costing you in the long run. Now let's talk about those marketplace metal tiers. These can be very confusing to people, but it's actually pretty easy to understand. So there are 4 different tiers: bronze, silver, gold, and platinum. Now a bronze plan doesn't mean it's the worst plan, and a platinum plan doesn't mean it's the best plan. It all has to do with the cost sharing structure. So with a bronze plan, your insurance carrier will pay 60% of the bill and your coinsurance is 40%. Silver is 70-30, gold is 80-20, and platinum is 90-10. So those higher tier plans, gold and platinum, are usually better for people with more extensive medical needs. Generally speaking, they come with higher monthly premiums, but it still works out in your favor if you have more extensive medical needs. Now, silver and bronze are better for people with more basic medical needs who are looking to save money on a monthly premium. The one thing I do want to mention is if you're eligible for extra savings, that would be available with silver plans. And if that's the case, we highly encourage you to check it out, because if you are eligible for those extra savings, you actually may have lower copays or coinsurance even than a platinum plan. So now that you're familiar, let's head over to Healthcare.gov to take a look at the plans. But before we do, a brief reminder that at iHealthBrokers, we are licensed health insurance brokers. We're licensed nationwide and there's absolutely no charge for our services. So if you have questions about your health insurance, or you need assistance with the enrollment process, you can reach us in the comments below or at the number on the screen. Also, we do release these videos on a weekly basis, and this year there have been more updates than ever before. So please make sure to subscribe to stay up to date and make sure to like this video so we can get this information out there. All right, let's take a look at those plans. Okay, folks, well, a complete disclosure here. So when planning this video, I had absolutely planned on walking you through the plans for 2026 and giving you a little preview. However, due to the government shutdown, it looks like the plans for 2026 still aren't available for preview. Now, that may change by the time I publish this video, and if that's the case, I will make sure to update this. And of course, once those plans are available for preview, we will release a new video. Now, if you're in a state that uses their own individual marketplace, then you may have access to those plans already, but here on Healthcare.gov, we just don't have them available for preview just yet. That being said, for the purposes of this video, all the same principles apply, because in today's video, we are talking about how to pick the best marketplace plan. We're not really specifically discussing 2026 plans. So, that being said, we will scroll on over to where it says Browse Plans and Costs. Here you would enter your zip code. And of course, your zip code and your household size and your income is what determines your eligibility for those premium tax credits. That's why they will ask you some questions here. Now, of course, you could skip over that, but we're not going to do that because we want to look into those premium tax credits, which may change drastically for 2026. So let's put it's us and other people, that we are legally married, and that we will claim dependents on our federal tax return. Okay, let's say 2, continue. All right, we are, I feel like I always use the same information, 35-year-old female who is the legal parent or guardian of a child under 19. We won't put eligible for health coverage through a job because that would make us ineligible for a premium tax credit. We're not going to put pregnant. They ask that because of Medicaid or a tobacco user. That can change things as well. So let's continue. This is our spouse. We will also put that they're a 35-year-old male, legal parent. None of the rest of these. Continue. Now let's say we have a 2-year-old male. Now obviously none of the rest of these apply. So we would click none of these. Continue. And a 4-year-old female. None of these apply. So we click none of these and continue. This is our household. We confirm this is correct. And move on. Now let's put in our income. Okay, let's put $75,000. Continue. So here's our estimated savings overview. $1,280 per month. So that would be the discount that we would see reflected. Now, of course, if we put a higher income, we would probably see a lower discount. If you were to put a lower income, then it might actually redirect you towards Medicaid or CHIP. So for the purposes of today's video, this is our income. Now let's say view plans. Oh, but I did mention this earlier. You may be eligible for extra savings if you pick a silver plan. In addition to tax credits to lower your monthly premiums, it appears you qualify for extra savings on other costs like deductibles, copays, and coinsurance. To get these extra savings, you must pick a silver plan. So that's why I said earlier that if you're eligible for extra savings with silver, silver can actually end up being more cost effective than even a platinum plan, even if you're someone with higher medical needs. View plans. Going to click out of that. So here are all of the health plans available based on the zip code that I put in. 104 plans. Now you will see, because of the income that I put in and the tax credit that's being applied, that there are plans that have actually no charge per month. If I had put in a different income, then you would probably still see some type of monthly premium. And of course, as we move up, we'll see additional monthly premiums as well. Now, over here is where you can add filters, and over here is where you can sort by. So if you were someone who knows that you have more extensive medical needs and you are not as interested in the premium as you are in the deductible, you would go ahead and click lowest deductible. These plans will have higher monthly premiums, but no deductible. That means that as opposed to a plan with a deductible, you don't have to pay anything out of pocket before your insurance starts contributing to the cost share. So for someone with more extensive medical needs, you might want to sort by that. For the average Joe, sorting by lowest premium is just fine. But what you will want to do is add filters. These are very important. Let's start here with your monthly premium, your monthly budget. You know that you can only spend up to $500 per month on health insurance? Great, that's what you're going to go ahead and put in. Health plan categories. I wouldn't necessarily go ahead and filter with these because you just don't know. You know, that's not necessarily the most important as opposed to something like a hard number. If you know you can only afford $500 for your monthly premium, well, that's all you can afford. Now, based on the fact that we are eligible for extra savings with the silver plan, we might want to go ahead and click that. And I'm going to leave it unclicked just for right now, just so that we can, compare plans. I'm also going to delete this range. But I just wanted to show you how you could do that. Maximum yearly deductible, same thing. Now here is something you also might want to go ahead and put in. If you need an EPO, if you're interested in HMOs, or if you specifically need a PPO. In years past, it was really difficult to find PPOs on the marketplace. They have become more common, but as you'll see, most of the plans are still HMOs. Oh, how interesting. It looks like there's actually more PPOs than EPOs in this case. So if you are someone that absolutely needs nationwide coverage, you need to be able to go in and out of network, you need a PPO. There's no point in even looking at these other plans, because if you see a specialist and you need to be able to go out of network for that specialist, don't bother selecting an HMO or a PPO, because you're going to have to pay fully out of pocket if that's the case for that specific doctor. It doesn't really make any sense to click HMO. You still want to see the other options. Search by plan ID if you have a specific plan ID. Insurance companies, that's very important as well. So if you know that the doctor that you see takes Aetna, Blue Cross Blue Shield, United Healthcare, whatever, you want to make sure to include those insurance companies. That way you make sure that you're picking a plan where you can operate within network. Medical management program, if you want to make sure that it offers some type of coverage for that. Also, eligible for an HSA. So let me speak to my fire community, because that's who's generally speaking very interested in those HSAs. If you want a plan specifically eligible for an HSA, please click this. There's not a lot of plans that are eligible for HSAs, and this will filter it down tremendously. If that is a must-have for you, you want to click this box here because you're not interested in looking at those other plans. Medical providers, if you have providers that you definitely need to see, go ahead and add those. Prescription drugs, if you have medications that you definitely need to take, you want to go ahead and add those, so that way you can compare costs and make sure that your medication is covered, because it would be terrible to enroll in a plan and then find out that the medication that you need to take isn't covered, which means you need to pay out of pocket for it. That would be dreadful. So we're going to clear the filters and just take a look at these plans so I can show you some more aspects of Healthcare.gov. So right now it is filtering, or rather it's sorting by lowest monthly premium, and we are going to see a lot of plans with a $0 monthly premium because of that premium tax credit. These are the premium tax credits that were expanded under the Inflation Reduction Act and the American Rescue Plan Act, and that's a large portion of why we're in this government shutdown right now as Congress debates the extension of those expanded premium tax credits. So here we see our monthly premium. It's not going to estimate yearly total costs because, well, we didn't put any medications or anything like that for it to estimate. Our deductible. This is a family plan. $9,400. That is your deductible. That is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share. Now, that being said, look at this little snapshot here. Here are some services that are already covered. Primary care, $70 visit from day one. Specialist, $125 from day one. Urgent care, $125 from day one. That means that these types of visits are all covered even prior to meeting the deductible. That's very important and something that people don't often understand. People think that they need to meet this deductible before they can go to the urgent care or visit their PCP. But that's not true. It just depends upon the type of plan that you have. Now, where the deductible kicks in is something like emergency room care or inpatient care, hospitalization, etc. Now, if I had added doctors and facilities, that would be included here, or if prescription drugs, that would be included here as well. If this plan was of great interest, I could click View Plan Details. But for right now, what we're going to do is we're going to click Compare, because you can compare a few plans here. So let's scroll on down. I'm going to try to get us to a drastically different plan so that way we can see, we have a better comparison point. Let's see, 50%. Ooh, this one does not sound great. Let's go ahead and click that just so we can see. Wonder what this is about. All right, let's compare. What was that first one? Was that silver or bronze? Bronze. Okay, I'm going to scroll. I want to get us to a silver plan so that way we can see how that factors in. Let's see. Actually, I'm going to go ahead and filter now. Add filter. Silver. Apply filters. There we go. Let's see. Let's add this one. Okay, already I can tell you. So $206 per month. Yes, obviously, that's a lot more than $0 per month. But look at this. The deductible is $2,880. So obviously, if you are someone who needs more extensive medical care, if you know that you're going to need to be hospitalized, or if you're somebody that goes to the ER more frequently, then this is obviously going to be a better plan for you. Let's see, is this extra savings? Extra savings. Perfect. Let me check. Yeah, let's go ahead and compare this one. Okay, that's one silver. Oh, this has the easy pricing. That is easier to understand. So easy pricing plans include some benefits before you reach your deductible. From day one, you'll only pay a co-payment for some services like doctor's visits. These plans set the same costs for 10 benefits. Very helpful. As opposed to that other plan that we looked at, that bronze plan, where, well, you'll see in a moment that it was like a 50% coinsurance and you had to meet your deductible to get anything, basically. Now, that doesn't apply. Those 10 essential benefits. Preventative services will usually still be covered, even if you haven't met your deductible yet. Let's see. I want to compare maybe one more plan. Add filter. Let me get rid of this. Oh, no platinum plans. All right, well, let's take a look at the gold. Okay, let's take a look at gold here. Compare. Whoops, I already added 3. That's fine. We'll just compare these. All right. So here's the 2 bronze plans that we put in. Oh, it has an HSA. That's why. And here's the silver plan. I'll explain more of this in just a moment. So here's your bronze plan, $0 monthly premium because of that tax credit. Scroll down, $4,700 deductible, $9,400 family total, health and drug combined. So what this means is this is when you have an individual deductible and a family deductible. If you as an individual have spent $4,700, then you've exceeded your deductible and your insurance will contribute to the cost share. However, let's say you as an individual haven't had any medical spending, but your other family members, one of them had $4,600, one of them had $3,000, and one of them had another $3,000 or something like that, that would meet the family deductible. So even though you individually have not spent a single penny, then the family deductible has been met, so your insurance would contribute to the cost share, even for you, even though you haven't spent towards your deductible yet. It can be a little bit confusing, but basically it's there as a little bonus for people that are in a family plan. So here's your out-of-pocket maximum, $9,100, $18,200 for the family. It works in the exact same way. This is a bronze plan to give you a better idea of the cost share. Plan documents. Here's the summary of benefits, plan brochure, provider directory, list of covered drugs. So if this was a plan you were, expressly interested in, I would highly recommend that you check out the additional plan documents. Cost for medical care. So here's your deductible. Again, in-network tier. Did I only pick HMOs? I hope not. I'll check that out in just a moment. I do want to make sure that I have a PPO here. In-network, I'm sorry. These are all in-network, so we'll take a look at a PPO in just a moment. So, yeah, see, out-of-network benefits not covered, out-of-network benefit not covered, out-of-network benefit not covered. That's because these are all HMOs. So here's your deductibles, your out-of-pocket maximums when comparing these plans. I would say, let's see, in-network deductible, $5,000. I mean, this is obviously has the lowest. This was that silver plan with the extra savings. And look at the difference here between $4,700 to $1,400, basically. $9,100, $7,350, $1,800, $14,000. It's a pretty significant difference. Primary care doctor visit. So this is divided into tiers. Network tier 2, not applicable. Interesting. I would need to look more into that, why there's network tiers for your PCP. So these plans are the most similar. We've got a $70 visit from day one because this must have that easy pricing. $50 visit from day one. This one, 50% coinsurance after deductible. This is not a great plan. This is providing you with basically no benefits prior to meeting the deductible, and the deductible is significant. So this is not a plan that we would steer clients towards under ordinary circumstances, unless for some reason this is the best possible plan for you, but I don't see that happening. Let's scroll on down. Okay, so x-rays and diagnostics, 50% after deductible. That's pretty normal, 50% after deductible. That's pretty standard. Laboratory services, copay, which we like for laboratory services, 50% after deductible, 50% after deductible. Outpatient facility, outpatient services. Continuing down on some of these benefits, prescription drug coverage. So this is going to break it down based on the tiers of the medications. We didn't put in specific medications, but you can see what the costs would be based on tiers. And here are the tiers for marketplace plans. Generic, preferred brand, non-preferred brand, and specialty. Generic will be your least expensive, $3 copay after deductible, or $10. And this one's got 2 tiers of generic. Tier 1, $3, Tier 2, $30. Preferred brand, 50% coinsurance, 30% coinsurance, 50% coinsurance. Oh, so maybe this plan, which I said is not such a good plan, maybe this is a good plan for somebody that has to take a preferred brand medication, because believe it or not, a 30% coinsurance versus a 50% coinsurance is a huge deal when it comes to medication. Let's say this medication actually costs $1,000. Well, then this is $500 versus $300. That's a huge difference over a 12-month period. Non-preferred, 50%, 40%, 50%. Specialty, 50%, 50%, 50%. And it does have mail order pharmacies. Prescription drug deductible, so it's one. Sometimes they have 2 separate deductibles, one for health insurance, one for prescription drugs. This is all one deductible. Cost and coverage examples, it's the same every year. Pregnancy, type 2 diabetes, and simple fracture. Those are the examples they always use. Now, you probably can't plan for a simple fracture, but if you are planning on becoming pregnant, then having these costs is helpful. These are all kind of similar. Or if you're somebody that manages type 2 diabetes, this is helpful to know. Adult dental coverage, you can purchase that as an add-on. This one does offer child's dental. You can learn more here.
these medical management programs that you could filter by, and other services as well. Chiropractic care, infertility, helpful for people looking to plan a pregnancy, mental health and behavioral services, habilitative bariatric services, skilled nursing facility care, etc. So very important to go through all of these. Let me go back to the plans and we will look at a PPO as well. So get rid of this. Whoops, not what I want to do. Let me get rid of all of these. Okay, I'm going to find a PPO now. Add filter. We only want a PPO this time. Apply filters. Here we go. All right, here is a PPO, and let's compare. Compare 3 plans. Oh, good. I still have this here with the HSA because I did say I would mention that as well. So now we have a PPO plan as well. Oh, you see here, nationwide doctors. Okay. So deductible, let's see, bronze. Yeah, HMO, EPO, PPO. Okay, let's scroll down to costs for medical care. Here we go. So because this is a PPO, we have a separate deductible for in-network versus out-of-network, a separate and a separate out-of-pocket maximum for in-network versus out-of-network, as you can see. So once you've met that out-of-pocket maximum, though, regardless of whether it's in or out-of-network, you would have coverage for the remainder of the calendar year. It's going to show you different costs also for in-network versus out-of-network usually, because very often if you go in-network, it's going to be less expensive than out-of-network, which we can see here. So 50% coinsurance for x-rays and diagnostics in-network, 80% if it's out-of-network. Yikes. Now, hopefully you can avoid getting x-rays and diagnostics at an out-of-network location, but if it's a specialist or someone like that you really need to see, then it is good to have this additional flexibility offered here. So I just wanted to show you a little bit more about PPOs. I also did mention earlier HSAs, and that's why I was saying that it seemed like maybe some of these costs were a little bit higher. HSAs are a great benefit. They really, really are. However, they're going to get you in some way. Very often, the plans that have HSAs, you will notice that some of those costs associated are a little bit higher. It might be a high deductible health plan, which ordinarily has a lower monthly premium, but very often it'll be a high deductible health plan that actually has sort of a higher monthly premium. That's not so in this case. However, we do see that the deductibles are a little bit higher and some of those costs are a little bit higher, like 50% coinsurance after meeting deductible, and that's just to go to your PCP. It's not even for some of those more extensive services. So very often with an HSA, we will see that they're going to make up for some of those cost savings somewhere. So you really need to decide if an HSA is right for you. Let's go back to these plans. Now, as I mentioned, unfortunately, we are not seeing those 2026 plans right now. I wish we were, but because we are in the government shutdown, things are just a little bit delayed. So we will see how this all shakes out in the days to come. And as soon as we have an update for those 2026 plans, I will make sure to post that as well. But in the meantime, at least you can get a better idea of what it is that you are looking for in a health insurance plan when it does come time to make that decision.
So now you know what to do. Let's talk about what not to do. First, don't choose the lowest premium without checking networks or deductibles. Don't ignore prescription cost differences. And remember, a separate drug deductible may apply. Don't assume subsidies will stay the same. They may drop significantly in 2026. And don't miss your enrollment deadline. There can be different deadlines based upon the state in which you live. And finally, don't go it alone. If you need our assistance, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. And of course, make sure to subscribe to stay up to date, and please like this video so we can get this information out there. If you'd like to learn more about marketplace plans, I will put that in the playlist below. As always, thank you so much for watching and have a wonderful day. Bye-bye.